Well, the first day of school will be here before we know it. With the pandemic disrupting annual preventive health visits, childhood vaccination rates have been on the decline, and now the number of kids with required shots nationwide is falling below herd immunity. Joining us this morning to discuss, family physician Dr. Christopher Scuderi with the importance of getting your kids up to date by adding vaccines to your back-to-school checklist. Dr. Scuderi, good morning. Thanks for being with us.
Thank you so much for hosting me.
Absolutely. Let's jump right in here. Why is it so important for parents to follow their child's immunization schedules and ensure they're up to date before heading back to school in the fall?
So there's a few things that parents should remember. The first is now is the best time to make sure that your child is up to date on their recommended vaccinations. And as a family physician, I'm concerned that a number of children around the country may have missed their well child visits due to the COVID-19 pandemic. And as a consequence of this, they may be falling behind on their immunizations. And so one thing I want to stress to parents today is that our childhood immunizations are one of the most impactful life-saving measures in medical history. If you look over the past 20 years alone, it's estimated that childhood vaccines have saved the lives of 37 million children across the globe. And so it's really important that parents do everything they can to protect their children going into the school year.
Doctor, let's talk about the phrase herd immunity. Remind us why getting to that point is so important.
So herd immunity is a concept that we've heard a lot during the COVID-19 pandemic. And so to break it down for viewers, herd immunity occurs when a large portion of the community becomes immune to a specific disease, and this makes the spread of the disease from person to person unlikely. And why this concept is important is if the level of immunity in that community drops just 1% lower than the threshold needed for herd immunity, it puts that community at risk of a devastating disease outbreak. And a great example of this in the United States is measles. In the year 2000, measles was declared eliminated in the United States, yet in 2019, we had over 1,200 cases of measles over 31 states. And so it's important to remember that these diseases are still occurring in other parts of the world, and it's important that we do all we can to improve herd immunity here in the United States.
And timeline-wise, if we want our kids fully vaxxed by the first day of school this fall, when do we need to have them immunized by? Can you break that down for us?
So as a parent, I would encourage you to do it now. I know summer gets busy and it seems like school's far away, but it's just right around the corner. And there's a couple of reasons why this is important. One is that the weeks right before school starts tend to be some of the busiest at a physician office. And so you want to make sure that your child's able to get in. The second is that a number of the vaccines that we give are given in series. So it may take a few weeks to get the vaccines, and it may also take time to develop peak immunity. The third is a great opportunity, if anyone's listening that has any fears or concerns about vaccines, to set aside some time to talk to your family physician about that. It's one of the most rewarding parts of my job is talking to parents and to patients that have concerns and kind of walking them through it and making sure we're doing what's best for them.
What are some of the biggest concerns you hear from parents? What are they most concerned about?
You know, they're concerned about safety and long-term safety of these vaccines. And so, we just want to look through, with parents, the process that was used to develop these vaccines, the trials that were used, and making sure parents understand that they are safe and effective. And so a lot of times it just takes going through the data and making sure parents are comfortable with that.
Yeah, absolutely. Now, children ages 6 months and older now eligible for the vaccine. How do the doses and efficacy numbers measure up across age groups?
So the Pfizer and Moderna vaccines were both recently approved for children 6 months and up. There's a couple key differences between the two that I want to stress for parents. The Moderna vaccine is a 2-dose vaccine. It's spread out amongst 4 weeks. The Pfizer vaccine is a 3-dose vaccine. So you get original dose, 3 weeks later you get the second dose, and then 8 weeks after that second dose, you get the third dose. And so it's important for parents to remember that that third dose is not a booster. It's part of the primary vaccination series, and that kids need all 3 doses to be fully vaccinated. One of the things I would encourage parents to know is that these vaccines are fractions of the adult vaccines, and so they were designed to really minimize side effects in this age range. The other thing that I want to encourage parents of is if they have a child at home that's 5 and up, and it's been 5 months since they've had their original COVID-19 vaccination series, they're due for a booster, and we recommend that they get that.
Okay, excellent. Where can folks go for more information on this?
So 2 great resources. One, your family physician is there for you, so don't be afraid to ask questions. The second, there's a terrific website, familydoctor.org/vaccines. It's got great information that you can access anytime.
We really appreciate the time and all the information. Family physician Dr. Christopher Scuderi, thanks for taking the time with us today.
Thank you.